Hi guys, today I will be talking about Cppd, which is calcium pyrophosphate deposition disease. It is a disease of the elderly, seen in almost 35 to 50% of those who are above 85 years of age. It is seen in associated with ANK gene mutation and also mutation in the ATP pyrophosphate hydrolase enzyme. Now, mutation of this enzyme causes increased production of pyrophosphate. This pyrophosphate combines with calcium to get deposited as calcium pyrophosphate inside the joint space. This crystal of calcium pyrophosphate triggers an inflammatory response within the joint space by recruiting the macrophage and neutrophils and causes its clinical manifestations. It is seen that CPPD disease is associated with certain conditions like aging, hemochromatosis, hyperparathyroidism, hypomagnesemia and hypophosphatemia, meniscal surgeries, Gentleman syndrome, and certain dysplasias. Clinically, it can be absolutely asymptomatic, or it can present with an acute, subacute, chronic, and a rapidly progressing phase. It can it can worsen pre-existing osteoarthritis. It can present as trophies. It can present as a rheumatoid arthritis-like syndrome. It can present basically spinal involvement with spinal stiffness and decreased mobility, and it can present as a something like a neuropathic joint with rapidly destructive progressive course. The joints involved in this disease are basically large joints like the knees, the elbows, the shoulder joints. Now, whenever we have to diagnose this condition, one, we have to prove it. Secondly, we have to presume it. When we do an imaging on X-ray, we can see deposition of this chondrocalcinosis, which is deposition of calcium on the chondrocyte or the cartilage, which we can see on X-ray or imaging. When we have to prove it, we have to aspirate the synovial fluid and demonstrate these CPPD crystals, or we also find normally some inflammation in the form of more than 1 lakh cells. The treatment basically remains rest to the joint, NSAIDs, a short course of intralesional steroids, which are beneficial. Colchicine can be tried in low doses, and some people do use HCQs. However, there has been studies which interleukin 1 beta antagonist, which is anakinra, which has been seen successful in polyarticular CPPD.